Hi and welcome back to Antai Hospital's YouTube channel, and today we'd like to continue on the topic of late miscarriages. So previously we've talked about, in our last few videos, we talked about short cervix, cervical insufficiency, all of which lead to late miscarriages. Now there's one more factor that we need to talk about, which is a common recurring topic here at Antai Hospital and affects a substantial amount of women in the world, which is Hyperemesis Gravidarum. HG, which is its nickname, can cause both early miscarriages and late miscarriages. Now, if it happens after the week 12 all the way until week 28, then we classify this as a late miscarriage because it's happening in more advanced stage of the pregnancy, usually in the second or third trimester, when the pregnancy is much more mature now, it has significant size and pressure. This is also known as a pressure-induced late miscarriage or miscarriage because it's usually due to the immense pressure of the fetus, of the pregnancy, of the womb exerted on the pelvic region, on the cervix, because it is unable to withstand these pressures, causing this late miscarriage to happen. Now, rest assured, these types of miscarriages, late miscarriages, happen much more rarer compared to their counterparts, early miscarriages. Only 15% of miscarriages happen after week 12. So they don't happen that often, but if they do happen, it is caused by these three factors: cervical insufficiency, short cervix, and hyperemesis gravidarum, and they lead to pressure-induced late miscarriages. So today we talk about hyperemesis gravidarum. Now if you'd like to find out about the two other factors that we mentioned, please visit just our recent videos. So HG can cause late miscarriages because of how it causes severe symptoms. Now, how does it cause pressure-induced miscarriages? Is due to one specific symptom, which is the excessive violent vomiting. Now, this excessive violent vomiting, amongst other severe symptoms, it's already very debilitating. But this excessive violent vomiting not only causes bile and blood in your vomit, causes tearing in the esophagus, and affects your fluid intake, but it also causes muscle contractions in the digestive system, in the abdomens, and connection to that, it can also affect uterine contractions as well. Now imagine if you're constantly coughing, constantly vomiting, the muscles tend to get tense and the contractions seem to go up constantly. And now these muscle contractions can affect uterine contractions as well, and can easily cause a late miscarriage if it's not dealt with properly. So the common symptoms of HG, which is violent vomiting, excessive nausea, insomnia, and hypersalivation. Now what it leads to is malnutrition within the mother, leading to the baby being malnourished as well, losing a lot of weight, causing acidosis, ketoacidosis, and electrolyte imbalances, several other complications. If the patient has pre-existing disorders, it gets much more complicated, but that's how it leads to late miscarriages. Now, because many women do not know that Antai Hospital offers treatment for this, they end up going for abortions, and not only to end the torture, but to preserve their life, because HG not only leads to miscarriages, there have been reported cases of maternal deaths caused by HG, so this is very serious, and we need to raise awareness on this rare disease, because not only it is rare, many doctors, medical institutions do not even recognize it. They believe it is fully psychological. So Antai Hospital offers treatment in this area using our HG vaccine, highly effective injection treatment. Now when received at the proper time, can completely eliminate its symptoms, securing you 9 months of full-term smooth pregnancy. You can also receive this treatment during the midst of hyperemesis, during the midst of pregnancy, but we will need you to be hospitalized, and we need to treat your complications as well. But regardless, you will need to come to Antai Hospital physically to receive this treatment, personalized, comprehensive treatment for hyperemesis gravidarum, and you will be guaranteed to be recovered within a week of receiving our treatment. Our treatment works in the forms of injections, no pills required, no IV fluids required, only 8 to 16 injections depending on your severity. once per day or twice per day, depending on your diagnosis, and very soon you can be fully recovered and you can be discharged. This is a revolutionary breakthrough of Antai Hospital. So do share this video, and for those who are suffering from HG, let them know that there is proper treatment at Antai Hospital with our HG vaccine. Please get in touch with us via the website if you'd like to talk to us directly, and please schedule an appointment, or if you're directly coming to Antai Hospital, make arrangements with us today. Stay tuned in the next video and leave me some feedback down below.